Hi, I'm François Houÿez from the European Organization for Rare Diseases, and this video about the HTX project, Next Generation HTA, Health Technology Assessment. I would like to introduce you again to this tool to select patient-reported outcome measures of interest to you. And in this particular video, I'd like to present you the EQ5D scale to measure quality of life. So when you visit the website where you can find the app, the PROM Select app, and it's on prom/select.eu/proms, where again you can access many patient-reported outcome measures that exist, that are validated, and that can be used for different conditions. So here, for example, if you select generic prompts, which are not intended for specific diseases, but that can apply to and be used for all diseases, then you have the list of all existing tools and scale to assess quality of life in general. So if you look, for example, in EQ5D, the European Quality of Life 5 dimensions, this is the information that you will find. So first, a link to the tool in question, which we will use in 1 second, different sources of information on where to find more information. So it's a tool to measure patient-reported health status. And it explores 5 dimensions, which are mobility, self-care, usual activities, pain, discomfort, and anxiety, depression. The other information you can find, the original article on the design and validation of that tool, but then other articles published about the use of that tool, and more recent articles and different sources that you can find. The languages that you can find an adaptation of this tool: Dutch, Finnish, Norwegian, Swedish, English, and 181 other languages. So this is probably one of the most frequently translated patient-reported outcome measures. And who owns the license to use this tool, when it was first published, 1990, for which type of patients it can be used, for adults, whether patients were involved in establishing this tool or not in that case, and you can read all the rest of the information which is provided on this website. So if you click on Eurocall link here, you will arrive on this page. You can discard the cookies. And so here you have 3 choices. 5L is on 5 dimensions, 3L is with 3, and we will focus on the 5L. So you can get a sample, a demo of that scale, which is in English, and there are different versions. One that can be self-completed on a digital device, so self-completed by a patient on a digital device. Others, like the last one, it's not the patient who directly report, but there is an interviewer who administer who question the patients and report on these 5 dimensions. So let's look at the the English version of the EQ5D. So it's a PDF document which you can download, and then you can open it, and that's how it goes. Just 1 second, bear with me. So it's a health questionnaire. And these are, in fact, the 5 domains that this scale is exploring. And what you need to say is, as of today, how do you think you feel? So regarding mobility, whether you have no problems at all in walking about, in that case, you would tick that box. You may have slight problems, moderate problems, severe problems, or not being at all able to walk about. So you tick the box of that corresponds to your situation as of today. Same for self-care, and self-care, the type of questions is problems with washing or dressing yourself. You can have no problems, slight problems, moderate problems, severe problems, or not being at all able to wash or dress yourself. Usual activities, so with some examples: to work, to study, some housework, family or leisure activities, where again you may have no problem at all, slight problems, moderate problems, severe, or being unable to do your usual activities. Regarding pain and discomfort, you may have no pain or discomfort, slight pain or discomfort, moderate pain, severe pain, extreme pain. And lastly, depression. You can be not anxious at all, or slightly, moderately, severely, or extremely anxious or depressed. And the last page, it's asking you how you would rate your own health on this scale from 0 to 100, 100 being the best possible health you can dream of, all parameters, all characteristics included, and 0 being the worst healthcare you can imagine for yourself. And so you both mark an X where you think you are today. For example, you can mark an X on 80, on 90, 75, and here you report in the box the value that you indicated on the scale. So that's how it works, and then the results will be collected from different patients and processed, analyzed for an EQ5D score, which calculates all based on what you will respond to the 5 dimensions, which will calculate a score which will indicate from a scale from 0 to 1 your quality of life status on that day based on these questions. It's a very generic questionnaire. It doesn't address specific symptoms of specific disease because it was purposely designed to be used to compare different state health status of different patients with different disease responding or not to different medical interventions. So it was designed to be used universally to measure quality of life. It is largely used again, but probably you will not find here all the questions that you think are important to ask to assess your own quality of life. Again, these are the limits of this tool. This is the EQ5D, which is often used in specific circumstances, for example, to conduct cost-utility analysis in the UK by the Health Technology Agency body, but also in the Netherlands. Not all countries, but usually it is used in clinical trials as a generic scale, and also together with a more disease-specific scale, which will better inform on the evolution of quality of life, of your quality of life, when you have specific conditions, and usually both types of scales, generic ones and specific ones, are used together. If you want to learn more on the EQ5D, there are resources here and articles that explain the use and the validation of this scale. And I thank you for your listening to this presentation.